Hey everyone, and welcome back to the Patient's Guide. We're all about making these complex medical topics a little easier to digest. So today we're going to be diving into iatrogenic flatback syndrome. And I know that sounds a little intimidating, but trust me, it's really important, especially if you're dealing with back problems or thinking about things like spinal fusion surgery.
It can be a little bit of a scary term, iatrogenic, but all it really means is that a condition is caused by medical treatment. So really, when we say iatrogenic flatback syndrome, we're talking about the flattening of that natural curve that you have in your lower back, and it happens as a result of some medical procedure.
Okay, so let's break this down a little bit more. We're actually basing today's dive on some research that looked at this condition in patients who needed a second spinal surgery. And the results are actually pretty surprising.
They're interesting, for sure. One of the things that we found is that almost half of all the adult spinal deformity surgeries that happen are actually repeat surgeries. And of those repeat surgeries, almost half are needed because of this iatrogenic flatback syndrome. So the study focused on people who needed a second spinal fusion because this flatback developed after their first fusion.
So that's a lot of people going through a second surgery that maybe they could have avoided. So tell me about this study. How many people were actually involved in this?
Yeah, so it was a pretty big study. It looked at 785 patients in total. Out of those, 355 needed a second surgery, and then 174 of those revisions were specifically because of these short fusions, which kind of contributed to that flat back problem.
So what exactly are we talking about when we say short fusion?
Yeah, so short fusion basically means that first fusion surgery didn't cover enough of the spine. When surgeons do a spinal fusion, they're joining together several of these vertebrae, which are those bones that make up your spine, and they're joining them together to try to create stability. But if that fusion doesn't extend far enough, it can mess with the natural curvature of the spine, and that leads to that flat back look. A short fusion can make your spine unstable, and that's what causes the pain and the limited movement and potentially needing another surgery to try to fix that problem.
What did they find out?
Yeah, so they found some interesting stuff about the people who needed those second surgeries. They tended to be older, so the average age was about 66. They were also more likely to be overweight or obese, and they generally just had worse overall health compared to the folks who were only going through their first spinal fusion.
So it sounds like age and weight and just your overall health could play a role in how that first surgery goes.
Yeah, and that's something that's really important to think about. Understanding all the factors involved before jumping into something major like a spinal fusion. The most common reason was something called sagittal malalignment, and that affected about 65% of the patients.
Okay, sagittal malalignment. What does that even mean?
So picture this. You're looking at someone's spine from the side, and a healthy spine has a natural S-curve to it. But with sagittal malalignment, that curve is off,
So their back is basically too straight.
and that can cause a lot of problems. Pain, difficulty standing up straight, problems with balance, even digestion can be affected.
So what were some of the other reasons that people needed a second surgery?
Well, the second most common reason was something called proximal junctional kyphasis.
Okay.
It's a mouthful, I know. But basically what it means is the spine is curving forward too much at the top of that previous fusion. So about a third of the patients had this.
So the lower spine is too flat, but then the upper part is curving too much?
And that can put a lot of stress on the spine and lead to pain and other problems.
So what else did the researchers find?
About 25% of the patients were having what's called radicular pain, which is that nerve pain that shoots down your leg. It's often caused by spinal misalignment that's pinching the nerves.
That sounds awful.
And then there's pseudoarthrosis, which affected about 19% of the patients. And that's when the bones in the fusion, they don't fully fuse together.
So even though they had the surgery, the bones didn't actually join properly.
Right. And if the bones aren't solid, that means the spine isn't stable. And that can lead to all kinds of issues.
So it seems like one of the big problems here is this undercorrection of the spine's natural curve during that first surgery. And the study actually found that 92.5% of patients who needed a second surgery had this issue.
Yeah, that's a big takeaway here. In most cases, that first surgery didn't create enough of a curve in the lower back. And what's even more concerning is that only a tiny percentage of these patients had their spinal curvature corrected to what's considered ideal during that first surgery.
So there's a big difference between what doctors are aiming for and what's actually happening in these surgeries.
Exactly. And that's a problem because it means a lot of people are going through this complex procedure, but they're not getting the best results. And remember, these second surgeries are often way more invasive. The study mentioned patients often needing 3-column osteotomies.
Okay, I'm not familiar with that. What is a 3-column osteotomy?
Basically where they cut and reposition the vertebrae.
So it's a much more serious operation than the initial fusion.
Yes, much more serious. It means higher risks and a much longer recovery time.
So for someone who's maybe thinking about spinal fusion surgery, what should they be thinking about?
I think the biggest thing is talking to your doctor, how they decide how much correction is needed, and what steps they take to try to prevent things like iatrogenic flatback syndrome.
So really just being your own advocate and asking those tough questions.
Exactly. It's your spine, your health, your life.
Yeah. We've learned a lot about flatback syndrome today. It's definitely something to think about if you're dealing with back problems or considering that spinal fusion surgery. This has really been eye-opening. It really stresses just how important it is to have those conversations with your doctor and to do your research and be informed.
Yeah, absolutely. Knowledge is power, right? Especially when we're talking about our health. The more you understand about your condition and all the different options, the better decisions you're going to make.
So to sum everything up, what have we learned today about this iatrogenic flatback syndrome?
It can happen after spinal fusion surgery, and a lot of times it's because the spine's natural curve wasn't corrected enough during that first surgery. And that can lead to a bunch of other problems down the road, pain, trouble moving around, and even the possibility of needing another even more serious surgery later.
And while spinal fusion can be a really good option for a lot of people, it's important to be aware of the risks. We really hope this has been helpful for you guys. We want everyone out there to be informed and empowered when it comes to their health.
If you're thinking about spinal fusion, talk to your doctor, ask questions, make sure you really understand all your options.
And we'd love to hear from you guys. What did you think of this episode? What stood out to you? What questions do you still have? Leave a comment below and let's keep this conversation going.
Thanks for joining us on The Patient's Guide. We're here to help you make sense of all this health information and make the best choices for your care.
If you enjoyed this episode of The Patient's Guide, you can find more below.